Alrighty guys, we've got a lot to get through today, a couple of different topics on the agenda. So I'll go ahead and get started, okay? Let me know if there's anything that I say that you couldn't hear, didn't make any sense. Stop me if you have any questions along the way, okay? First, we're going to talk about hydration and its whole body importance. So why it matters, how dehydration affects us, yes.
Who are you, in case people don't know?
In case you guys don't know me. My name is Peyton. Thanks, that's a good question, Kevin. I'm the therapy manager, so right behind the multi-purpose room is the therapy gym. That's where I live. So my name is Peyton. Happy to meet you guys, and I'm happy to see you guys here today. So anyways, hydration, dehydration, how it affects the body, and practical strategies on how we can stay hydrated. So what can you guys expect to learn from my hydration presentation today? Just a couple of facts that might shock you about hydration, why it matters, what hydration looks like versus dehydration, benefits of drinking water, practical ways to increase fluid intake, and as always, my goal is for you guys to leave with 1 or 2 small strategies that you can implement each day to make a lasting impact. I'll say this every time, I'm not asking anybody to make a huge overhaul in their lives. Just find one area of improvement and start there. So a couple of fast facts. The human body is made out of 60% water. I had an idea that that was the case, but what shocked me was our brains are made of 95% water, our lungs are 90%, blood is 83%, and our muscles are 76% water. That's a lot of water, right? So water is second only to oxygen for the body to survive, right? We can even go longer without food than we can without water. Water is measured in days in terms of if we don't have it, our bodies start to decline. Food, we can last longer. Water, we're talking days before we see that effect. So the importance of hydration. Like I just said, nearly everything in your body requires water. Water supports nearly everything that your body does. So it transports nutrients, it regulates your body temperature, it supports digestion, it moves waste out of the body. Proper hydration can improve your energy, your mobility, your focus, your sleep. So small hydration habits practice consistently over time can make those bigger impacts on your health. And as we age, everything is a little bit more important, right? We need a little bit more of this and a little bit more of that. So hydration is one of those things that becomes a little bit more challenging as we age. Our sense of thirst often decreases, so we don't really realize we're thirsty. Your brain is not sending a trigger to say, hey, we need a drink of water as fast as it does when you're younger. So kidney function changes, medications that we start taking have an impact on your fluid retention or your fluid loss or how thirsty you are. You might notice you started a medication and your mouth is dry, right? That's a common side effect of a lot of medications. Mild dehydration can contribute to confusion, fatigue, dizziness, falls. So that's why it's important to kind of stay ahead of this. Let's talk a little bit about water as it supports energy production and brain function and physical health. So when we are properly hydrated, nutrients and oxygen reach the tissue in our body to help our bodies move more efficiently. It improves your thinking and remembering. It's sending that water up to the brain that the brain needs to do its job too. Concentration increases. Your mood is a little bit more stable. Hydration also helps lubricate the joints. So it helps you move better and easier and more pain-free, so that, you know, we're a little bit more comfortable throughout the day. Hydration means maintaining adequate fluid levels, right? So dehydration occurs when fluid losses are greater than the amount of fluid we're getting in. Many people believe that when they feel thirsty, they should take a drink, right? But that's not always true, actually. A lot of times, especially as we age, we're already dehydrated before we feel that thirst. We're going to talk a little bit about electrolytes and what they are and how they support hydration as well. So hydration goes beyond just drinking water alone. Electrolytes such as sodium, potassium, magnesium, calcium, and chloride help regulate your fluid balance. They help nerve signals and muscle contractions. So think of water as the fuel and electrolytes as the system that helps the body use the fuel effectively. Okay? Electrolytes will help you maintain a stable blood pressure. They help your muscles function, your brain function, and proper fluid distribution throughout the body. So those electrolytes are also supporting how our body is using and distributing the water that we are drinking. Older adults are more vulnerable to electrolyte imbalances due to medications, chronic illnesses, reduced kidney function, and that diminished thirst sensation that I was talking about. So, some common signs of dehydration. A lot of us know dry mouth, right? That's an easy one. If our mouth is dry, we're probably thirsty. We can also look at the color of our urine, and if it's darker, that probably means we're not getting enough fluid. If you're not going to the bathroom as much, you don't have as much water intake, so you're not having as much fluid output as well. Fatigue, dizziness, muscle cramps, confusion. So a lot of these things could be a good indicator that maybe we need to be drinking a little bit more throughout the day. But a really good and simple indicator is just monitoring the color of your urine, okay? Pale yellow is a good color. Anything kind of towards the darker end of the spectrum could indicate dehydration.
Can I stop you?
Yes, you may. We have a question.
Previous slide, electrolyte.
We've got a microphone coming for you, Margaret. Thank you.
Hi, Margaret.
Oh, hello.
Hello.
Going to the previous or two slides ago, you're talking about electrolytes. How do we get those? What do we look for at Kroger's?
We'll talk about
Okay,
that.
okay.
Yep, we can get electrolytes from the food that we're eating. Okay, good question. Margaret was asking, where do we get these electrolytes? We can get them in some of the foods that we're eating and drinking. We will cover that, okay? So what does water do for you? Everything, as I mentioned, right? Brain, body function, organ function. So we're going to continue talking a little bit more about that. So water is lubricating the joints. It is supporting that saliva production. So that's helping us swallow easier too, right? It helps mucus production. It helps transport oxygen throughout your whole body. Healthy joints move more comfortably. Saliva, like I mentioned, helps digestion and oral health. And better circulation helps ensure oxygen reaches tissue where it is needed, okay? Hydration also supports skin health and brain function. So dehydration can be seen in your skin as well by dry skin. and water helps maintain a healthy body temperature and through sweating. So if you're hydrated, then you're sweating, right? And that sweat is helping you maintain a normal body temperature within. We talked about how water is essential for bowel function as well. So digesting the foods that you're eating and drinking. Water helps push food and waste throughout your body and to help you digest that properly. It supports kidney function, it prevents constipation, it helps maintain a healthy blood volume and a blood pressure. So that reduces the strain on your cardiovascular system. If your heart doesn't have to work as hard to pump blood through the rest of your body. So let's go from the why to the how. So how are we going to make sure that we're getting enough water? One easy strategy is carrying a reusable water bottle. Keeping that full and keeping that with you. When water is accessible and visible, we're going to drink more. And I find that that's incredibly true for myself. If my water bottle is sitting on my desk and it's full of water, I'm gonna drink it all day. If I have to stop and go fill it up, it's gonna take me an hour or two to stop what I'm doing and go fill up my water bottle, and then I'm already thirsty, and then we're looking at that dehydration, right? So another way would be maybe setting a reminder on your phone. Every hour or 2 hours, maybe set a reminder, take a big drink of water or have a bottle of water, something like that. I know a lot of people get into a routine where they might drink a glass of water before every meal or with every meal, okay? So then you're ensuring at least 3 bottles of water a day, and then you can kind of add in that extra water throughout the day. So again, I'm not asking anybody to make any huge life changes. Let's just throw some water in every now and then when we can. So how are we going to get enough water? If you're like me and you don't really enjoy the taste of plain water, we get creative. Is anybody else in the room like me and hates water? One, okay. It's an odd thing. I flavor my water. The best way to do that would be fruit. So lemons, berries, oranges, cucumber, mint, anything to add. We've got some no's in the crowd too. That's okay. If you like plain water, excellent. But another key point that I really want to make is that hydration doesn't come from just water. Okay, we can get hydration from milk or tea or broth. So even like soup, right, is hydrating. Diluted juices can all contribute to your daily fluid intake. However, it is important to note that if you are not drinking plain water, we should be reducing or trying to reduce the caffeine and the sugary beverages. Kind of counterintuitive if you're counting that as your hydration. So about 20% of our hydration also comes from the foods that we eat. Some foods are quite high in their water content, so fruits and vegetables like watermelon or cantaloupe, strawberries, lettuce, celery, cucumbers, tomatoes, and oranges. So adding these things into your diet is already going to support good hydration. And it's a good strategy to use if you feel like you don't enjoy drinking enough water. Okay, so back to Miss Margaret's question about electrolytes. Let's flip back. I did think I had a slide on that, Margaret, but we'll talk about it. Right here. So can anybody think of any foods that are high in potassium? Bananas. Yep. So bananas are a good source of electrolytes. How about calcium? Yogurt, milk. Excellent. we get enough sodium, right? So some of those foods are going to support your electrolyte balance. They do make powdered supplements as well, Margaret. I think though, again, if you're eating a whole balanced diet, like we've talked about before, if you guys are eating the rainbow, you're getting all of these key nutrients here, okay? So your electrolytes are coming from the foods that you're eating as well, okay? Are there any other questions about hydration? Okay. We are going to move on.
I got a question.
We have a question.
What about soda water?
Soda water is still hydrating, absolutely. Yeah.
Are there any concerns with soda water?
Only if we're looking at those that have the added sugars, right? And even then, again, it's still hydrating. We just want to stay away from the ones that are really high in added sugar or excess sugar. I drink soda water, like sparkling water, all the time. And those are great. Absolutely. Another question. Okay, yes.
Okay, I just wanted to ask, I hear different things about whether the water should be room temperature or ice water, which absorbs better.
Oh, I don't know which absorbs better. That's an excellent question. Huh. I would have to look into that, yeah. Couple hands, yeah.
How much water do we generally need? It seems like there's a whole gamut of amounts out there.
How much water do we need? Does anybody know what that number is? 6 to 8 what? Glasses a day, 64 ounces of water. Another rule of thumb is, and this is a little excessive, maybe like an ounce of water per pound of body that you are. So we're looking at more than that even, but we strive for 64 ounces a day, 8 glasses of water a day. Okay, good.
There was one more.
One more question? Right over here? Okay.
What are the trade-offs with beer?
Excellent question. There is still water in the beer that you are drinking. Just like those caffeinated beverages and the sugary drinks. There's still hydration in there, but we are doing a little bit of a balance because alcohol does have a dehydrating effect as well. It's all about balance, right? I'm not asking anybody to give anything up or change anything drastic. Another question.
Do salty snacks take water from your body?
Salty snacks, they help, they retain fluid. He is asking if salty snacks take water away from your body. And yes, if we're eating a lot of salty snacks, we'll see fluid retention, and that's not really what we want. So the salty snacks are a little bit different than the sodium. That's an electrolyte version, and I can print out actually and give you a handout on that as well if you'd like. Yeah. So the salty snacks are our bodies are going to retain fluid. That's not exactly the goal here. Okay. So stay away from the salty snacks. Balance, right? Okay. Any more questions? Okay, we're going to talk about urinary incontinence, and then we're going to finish with bone health. So we're kind of all over the place today, but I've got a lot of really good resources that I just want you guys to have at your disposal as well. So a common misunderstanding is that urinary incontinence is normal as we age, and it's just something we've got to deal with. That's not the case. So we're going to dive into that here, okay? So urinary incontinence affects, this says 13 million people. It does affect more women than men in the United States, and it is across all age groups. So women get hit by urinary incontinence twice as much as the men do. This is an important topic because it does happen as we get older, and we do think that it's normal and something that we have to deal with. It does impact quality of life, and it can cause embarrassment. It's an uncomfortable topic to talk about and to bring up with your friends. There are things to do about it, and so that's what I'm going to tell you about during this, presentation. So let's talk about normal continence. That means a person is storing their urine and emptying the bladder at an appropriate time and place. So your bladder should be able to hold increasing amounts of urine at a low pressure without leakage. That's a normal bladder. When it's time to void, your bladder muscles contract and the urinary sphincters relax and allow that urine to flow freely. Incontinence occurs when something interferes with this process. We're going to talk about all the different kinds of incontinence coming up. We call it the silent condition. Urinary incontinence is defined as an involuntary loss of urine. It's not a disease itself. Instead, it's often a symptom of an underlying condition. It's also important to dispel that it's not a normal part of aging, okay? While it does become more common, it can be treated and helped. One of the biggest barriers to treating urinary incontinence is not talking about it enough. This is something that deserves attention, deserves to be talked about. Many people suffering from incontinence suffer from lower self-esteem as well, or embarrassment, or they pull back from going to these social gatherings because they fear that they're going to have an incontinent episode. So then you guys are missing out on all of the things that you like to do because of this. It has physical effects as well. So if you're incontinent, you are increasing the risk of skin breakdown in that region. Pressure injuries, urinary tract infections. If you're feeling that sudden urge to go to the bathroom, you might get up really quick and take off toward the bathroom faster than your body's ready to carry you. So then we're looking at potential falls as well. So the emotional and the physical consequences can be pretty significant, right? But treatment is manageable, okay? So when assessing residents, oh no, I messed up. There we go. When assessing residents, it's important to look at symptoms. So frequent urination, urgency, bladder fullness, leakage when coughing or moving, difficulty initiating urination, or feeling like after you do go to the bathroom, there's still some left over. So these symptoms can help your practitioner identify which type of incontinence and then guide intervention from there. So the average bladder holds about 300 to 600 cc's of fluid. Average voids are 4 to 8. So you may go to the bathroom about 4 to 8 times in a 24-hour period. This is a normal bladder, okay? Nocturnal, so urination during the night generally occurs, but not maybe more than 1 time, okay? And then from the initial urge until the bladder reaches full capacity is about 1 to 2 hours. So once you notice that you need to go to the bathroom, you should have about 1 to 2 hours until your bladder is full, okay? Hydration, I know we just spent a lot of time about me making sure you guys are hydrated. Hydration and continence are closely connected. Many people mistakenly reduce fluid intake to control leakage, but inadequate hydration can actually worsen your symptoms. Concentrated urine can irritate the bladder and increase your urgency. So concentrated urine is happening when we're not hydrated enough. Older adults are particularly vulnerable to dehydration, as we mentioned, because your thirst sensation is decreasing as well. So adequate hydration is absolutely supporting your bladder health as well. So there are 5 types of incontinence. We have urge, stress, mixed, overflow, and functional. So we're going to talk about each different type as well. Urge incontinence is characterized by a sudden and intense need to go to the bathroom. That's the I have to go right now, and you're going to get up and take off for that. So these people might not make it to the bathroom in time. It can be often associated with urinary tract infections, so that sensation that you always just have to go. Bladder irritation, neurological conditions such as stroke, Parkinson's disease, multiple sclerosis, and dementia these people can have this urge incontinence as well. In urge incontinence, frequency and nighttime urination are common as well. Stress incontinence happens when your abdominal pressure overwhelms your bladder's ability to maintain control. So activities such as coughing or sneezing or lifting weights or standing may cause leakage. That kind of leakage is this stress incontinence. So weak pelvic floor muscles and sphincter muscles are common in this type of incontinence. Individuals also often use the restroom frequently in attempt to prevent these accidents. Then we have mixed incontinence, and it is a combination of urge and stress incontinence. It's one of the most common forms seen in older women. So that's saying you may experience both urgency-related accidents and leakage during movement or exertion. The next one is overflow incontinence. That happens when the bladder becomes overly full and can't empty sufficiently. Okay, so you're still having urine left over after you've gone to the bathroom. Instead of large accidents, we often see frequent dribbling or weak stream strength and a sensation of incomplete emptying. Common causes include urinary obstruction, nerve damage, neuropathy, and in men, prostate enlargement. And the final form of incontinence is functional incontinence. That it differs because the bladder itself may not be working normally, or it may be working normally, excuse me. So the problem stems from outside factors rather than your bladder itself. So impaired mobility, cognitive deficits, communication difficulties, environmental barriers, or lack of timely assistance. Those things are contributing to functional incontinence. This is where therapy can have a tremendous impact in assisting, improving your mobility, simplifying your environment, reducing clutter, and educating caregivers can drastically help improve functional incontinence. So, like I said, there are things that we can do about incontinence, right? There are doctors, there's treatment, so a pharmacist, pharmacological, so medication can help manage incontinence. You can speak with a surgeon. I would start with your primary care physician if you do have any of these sensations that we just talked about, and they can help you make the right judgment. Therapy can also help, occupational or physical therapy. They design programs to improve bladder control, decrease accidents, restore independence. We talked a bit about weak pelvic floor muscles. That's a muscle that can be fixed just like most of the other muscles in the body. So as therapists, we have an important role through assessment of strength or mobility or cognition and pelvic floor function. So we can identify what factors are contributing to your incontinence and help you kind of sort out which type of incontinence you have to help drive your plan of care. So we could expect to see improved bladder control, decreased accidents, increased self-esteem and independence, right? Some common interventions for incontinence include scheduled toileting. If you know you're going to have to go, maybe you just go every 2 hours to get ahead of it, right? Something like that. Habit training, prompted voiding, bladder retraining, It's also helpful, like a food diary, you have a urination diary, a voiding diary, so you're keeping track. I went at this time. Did you feel like you emptied your bladder completely, or did you have that sensation that there was something left over? That, again, can help put together some clues on what's going on. Relaxation techniques if it's a muscular issue, and adaptive clothing strategies if it's an issue of, well, I can get to the bathroom but I can't unbutton my jeans or something like that. There's all kinds of strategies that occupational therapy could help with. Additional strategies I mentioned briefly: environmental modifications, so lifestyle changes as well, dietary management, compensatory strategies for cognitive impairment if that's what's contributing, pelvic floor strengthening, and in some cases electrical stimulation and biofeedback to stimulate those muscles. So success is greatest when therapy collaborates closest with nursing and your primary care physician, dietary caregivers, and the whole medical team, and you as well. We did kind of go through urinary incontinence quickly as well. Who has questions about that? Yes.
Does drinking,
Hold on a second, let me come to you.
does drinking,
We're going to bring you a microphone so everybody can hear your question.
Does drinking cranberry juice help prevent UTIs?
Yes. The question was if cranberry juice helps prevent UTIs. Yes, if we're having the kind that doesn't have all the added sugar in it, cranberry juice can help clean out the urinary tract. Yeah. Any other questions about urinary incontinence?
Does it help with the urinary incontinence?
It's not going to, the question was if cranberry juice will help with your urinary incontinence. I think that it'll keep you hydrated. It's not going to cure urinary incontinence though. Yeah, any other questions? Okay, we're on to topic 3. You guys still with me? Anybody need to stand up and move around? This one's kind of quick, okay? We're going to talk about bone health. So when we think about aging well, we focus on heart health. We've talked about hydration. We've talked about what we eat. We've talked about staying active. Bone health obviously is incredibly important. They are all over your body and we have to take care of them. So they provide the framework that allows us to move, that allows us to stay independent and participate in activities. As we age, our bones naturally become thinner and weaker, which increases our risk of fractures. The good news is there is a lot that we can do to maintain strong bones throughout your whole life. So a bone is living tissue that is constantly changing. Old bone is broken down and new bone is built as we age. When we're younger, we build bones faster than we lose bone. Especially after 50, bone loss begins to occur more rapidly than bone formation. So the gradual loss of bone density can lead to weaker, more fragile bones. And of course, women are more particularly vulnerable after menopause because lower estrogen levels accelerate your bone loss. Men can also, of course, develop significant bone loss as we age as well, okay? Osteoporosis. I'm sure we've heard that a lot. That just means porous bones. Healthy bones look like a honeycomb under a microscope. With osteoporosis, those honeycomb holes become bigger, right? And that weakens the bone structure. The biggest concern is not pain with osteoporosis, it's fractures. Common fracture sites are your hip, your spine, your wrist, your shoulder. A hip fracture can be pretty devastating because well, any of them can. You've got the potential for surgery and hospitalizations and therapy and loss of independence. So it is very important to continue to support bone health throughout your life. Strong bones help us stay active and independent. Poor bone health increases your risk for falls. It increases your risk of hospitalizations, your reduced mobility, need for caregiver assistance. And these are all things that all of us here at Otterbein and my team at Functional Pathways, we do try to keep you guys in your home and keep you guys as independent for as long as we can. So as rehab professionals, we absolutely know that maintaining mobility is one of the best ways to maintain quality of life, and Healthy Bones plays a huge role in maintaining that mobility. So how are we going to protect our bones? Calcium is going to help. One of the most important nutrients for bone density and bone health is calcium. It is the primary mineral found in your bones. So if the body is not getting enough calcium from foods, it begins taking calcium from the bones itself, which can weaken your bones over time. So we did talk briefly about some excellent sources of calcium: milk, cheese, yogurt, fortified cereals, leafy green vegetables is also an excellent source of calcium. So it is great, it is best to get these nutrients from the foods that we are eating and drinks that we are drinking. I've talked many times, and I already said it today, eating the rainbow. So making sure that your plate is colorful is going to help you get all of the vitamins and nutrients naturally that your body needs. Another very important vitamin for bone density and bone health is vitamin D. So vitamin D actually helps your body absorb calcium. Without enough vitamin D, even the most calcium-rich diet is not providing its full benefit. So we can get vitamin D from sunlight exposure, fatty fish, egg yolks, fortified milk products, and supplements when they're recommended by a healthcare provider. Many older adults have low vitamin D levels, so it's important to stay up on your blood work and your labs with your physician just to see where you're at. Another really excellent way to take care of your bones is to move your bones. Bones respond to stress, so when we place healthy stress on healthy bones, they become stronger. So walking, dancing, doing stairs, going to the YMCA, standing exercises, all really great for maintaining good bone health. They work similarly, bones work similarly to muscles, so if we're not using them, we're not really helping them either, okay? So small amounts of activity, a short walk to, a neighbor's house and up the block, or a walk down to the therapy gym would be great in the long run to support your bone health. And those are the small habits that we can implement to make a lasting change. Strong bones are important, but preventing falls is equally important. So even healthy bones can break during a severe fall. Some fall prevention strategies include wearing supportive footwear, keeping your walking path, if it's anywhere in your home, or just your walking path clear of clutter, using an assistive device when needed. A lot of people really don't want to start with an assistive device like a walker or a wheelchair. Look around, we've all got them. A lot of us have them, and it's fine because we're safe. And then those walkers get us to the activities that we love and the friends that we love. So I think that's very important too. Improving your lighting. So a lot of falls happen when we get out of bed at nighttime to go to the bathroom. A night light would help with that, okay? But keeping where you're going well lit so you can see what your obstacles are will be important as well. And then balance exercises. If you're not confident in your balance, that's where those adaptive equipment or devices really come into play. Therapy can address balance, absolutely. So a combination of strong bones and strong balance and a well set up environment, really the best defense against these falls and fractures. So we're just going to summarize some of the simple habits that support healthy bones. So calcium, eating a calcium-rich diet, getting adequate vitamin D to support that calcium absorption into your bones, staying active, strength and balance exercises, avoiding smoking, limiting excessive alcohol use, and then bone density, just talking with your primary care provider on your blood work and on bone density, just knowing how your body's working, and making sure your primary care is in the loop with that as well. Couple of things just to keep in mind. Strong bones help maintain your independence. Bone loss is not an inevitable sentence. We can take these steps to slow down this bone loss and reduce your risk of fractures. And it's never too late to start. So like I've said before, take one small change from these presentations. And I've given 3 presentations today. So take one small change from each and implement those into your daily lives, okay? Does anybody have any questions on that or anything that we talked about? Because that concludes my talking at you.
Thank you.
Yeah, of course. Yeah, I'm happy to have you guys out here today. I really enjoy this. My company has a lot of excellent resources. A lot of this is stuff that I'm learning as I'm putting these presentations together for you. So we're learning it together. And I really hope to continue getting this out to all of you guys here at Otterbein. So thanks for showing up. If you guys ever need anything regarding anything that I talked about in any of my previous lectures, anything that I haven't talked about in my previous lectures, I'm really happy to have you guys come down and sit with me, and I can absolutely help you figure out who to go to, where to go, what to do. Just making sure that you guys are taken care of too, okay?
Peyton, can you tell them where your office is, for
Yeah.
those that don't know?
Yeah, right behind the multi-purpose room. If you're walking toward Rehab, TCU, there's the therapy room, and there's a bright green sign hanging from the wall that says therapy room. My office is right inside there, okay? Thank you guys. Happy Friday.